Hello, welcome to the StellaLife Innovator series. Today, we are honored to speak with Dr. DeWitt Wilkerson. Dr. Wilkerson is in private practice in St. Petersburg, Florida. He lectures internationally on the subjects of restorative dentistry, dental occlusion, temporomandibular disorders, airway and dental sleep medicine, and integrative dental medicine. He serves as a senior faculty lecturer and director of dental medicine with the Dawson Academy and has provided lectures and hands-on instruction to over 4,000 dentists. Dr. Wilkerson is a past president of the American Academy for Oral Systemic Health and the American Equilibration Society, and his book, The Shift, The Dramatic Movement Toward Health-Centered Dentistry, provides a step-by-step guide to implementing complete health through dentistry. Welcome, Dr. Wilkerson.
Thank you, Liz. It's great to see you. And thank you for the opportunity to visit with you today.
Oh, thank you for making the time for us, because I know how very busy you are. And you've worked in a cutting edge practice for 40 years and have been a dental educator for over 30 years. You've seen so many changes. Now, what do you see as the next great frontier in dentistry?
Oh, that's a great question. Well, we've seen so much happen and so many things have been refined in a beautiful way to where we've sort of perfected a number of subjects that are important to us. So the last several years, we've been asking that question: where do we go from here? What's next? How do we elevate dentistry? And really what we found is that, and COVID has been a positive thing in the sense of moving forward in our thinking, that we recognize that there are many comorbidities that relate to risk factors for health in a viral world. And so this subject of complete health or total health, whole health, is something that we believe dentistry should be engaged in as not just a specialty that focuses on carpentry of the teeth, but rather that we are the oral physicians and the specialists of the oral system that's part of the whole body. And so we see what we're calling integrative dental medicine as the next frontier.
Absolutely. And as a longtime hygienist and an educator myself, I really believe this is the key. And you're so right. Since COVID, people have suddenly become more aware, like the general public is looking at these relationships. So, sad about the situation, but it is a great opportunity for us to take them to a whole other level of health. So what is the focus of integrative dental medicine?
Well, integrative medicine, as you may be familiar, and those that are listening, is really the study of the whole person's health, not just their chief complaint and a diagnosis and a prescription, for example. Integrative dental medicine is dentistry's role in that whole health picture. And so what we've tried to do is we've studied this, listening to cardiologists and those that are dealing with Alzheimer's and diabetes and a variety of things, is to ask, where does dentistry fit in appropriately in this model of complete health? And we've been able to identify three pillars that we are calling it of integrative dental medicine that are the focus, three focuses of this subject. And those are inflammation and infection, both locally and systemically; airway, breathing, and sleep disorders, something that's getting a lot of attention in dentistry; and then temporomandibular disorders, dental malocclusions, which now we understand are related to breathing disorders and sleep disorders and a variety of these things. So we're seeing that there's a crossover between inflammation, airway, and TMD, and that we can combine those together and look at the whole person and come up with a lot of great understanding and solutions for people's whole health.
Yeah, they're all definitely related, and there are many different approaches to it, but an airway screening and offering some treatment is such an important key factor. Oxygen is important, so
Very important.
looking at dementia and other diseases, if we don't have that going, we're kind of doomed. So,
right.
And we are like on the front lines of actually looking at this. So having that skill set and know-how is so important. So I'm so happy you can provide that. So what is the greatest challenge, in your opinion, of creating such a model of dental care?
Well, the challenge, of course, is this is something that we're unfamiliar with. And so we have to become educated on what the true science is. For example, in dentistry, we're familiar with airway and sleep apnea. So we could make an oral appliance for someone that might help them, or would it? And so we have to be able to do proper evaluation, screening, testing, diagnosis. So that's a challenge. The other part of the challenge, I think, for us in dentistry is that we have to develop systems for this, even checklists that we use for being systematic and kind of calibrating all of us to be doing the same thing, whether we're in California as you are, or Florida as I am. And then to be able to educate the patients. How do we do that in a dental setting about systemic issues in many cases? Another issue that we hear a lot about is, and how do you monetize this? Can you make a business model out of looking at these different subjects that are very important? But obviously we're in the business of doing dentistry, both to make our patients healthy, but also to create a healthy practice. So that has to be part of the integrated model of trying to figure this whole thing out.
Yeah, absolutely. It can be complicated or simple, but it's great to have that model. And of course, there's profitability in it as well. But I think that most of us need some support. So how does a dentist or a hygienist learn how to implement interdental medicine and integrative dental medicine? And how do we
Yes.
go about that?
Yeah, that's a great question. Really, where I got my early training was through the American Academy for Oral Systemic Health, or we call it AOSH. It's an organization that's about 12 years old now, and we have an annual meeting in September, typically, all over the country. 2 days of 2.5 days of intense learning from experts, researchers, clinicians, physicians, dentists, nurse practitioners, hygienists that are all on the leading edge of this. So that's where I've gotten really my foundation. The challenge is that to go to a 2.5 day meeting and hear spectacular speakers, you go home and say, that was great, now what? And so you're kind of stuck with new information that you don't know how to get into action. And so most recently, we're now actually launching in 2022 what we're calling the IDM, or Integrative Dental Medicine Scholar Society, which is really an offshoot of AOSH its intention is to collaborate with different healthcare providers, dentists, hygienists, nurse practitioners, physicians, et cetera, and to create a model of implementation, which is really the big subject. How do you implement? And so that's the purpose of this new effort that is just starting right now.
Right. And I think you have an event coming up in March
That's right.
for which you are actually, we have scholarships available for our
Yes,
StellaLife doctors and
that's right.
the teams. So maybe you could tell us a bit more about that event. And by the way, I'm very excited to say I will be one of the presenters at the September meeting in Phoenix. So I'm looking forward to
Oh,
the
that's
workshop
right.
that we're doing with a team of hygienists. Is going to be
Yes.
pretty exciting. But tell us
Yeah.
about the event in March, please.
Yeah, so the first event of the IDM Scholar Society will be in St. Petersburg, Florida, right next to Tampa. And it'll be March 31st through April 2nd. And we're calling that the IDM Foundation Seminar, where we're going to describe the model of integrative dental medicine, talk about those three pillars of airway, breathing, sleep, inflammation, infection, TMD, and occlusion, how those connect, and then begin to give skills or present ways in which we can have skills and implementation on Monday morning for our teams. I'm very excited to say that we are partnering with StellaLife. Dr. Gennady Serrata, your CEO, is a dear friend of mine, and he has been very passionate about this. And so we're partnering together, and StellaLife will have a great presence there. And then StellaLife, in conjunction with what we're doing, is going to offer a 50% scholarship for registration for your friends and clients in the world of StellaLife. And so we have a special code. I'm sure you'll present that later. But for those that are listening, we want to invite you to be part of this. We want to make it easy for you to come. And StellaLife, being such a great supporter, is really making that possible from a financial perspective too. So we're hoping to have a great crowd there. We know we will. We already have many who have signed up. But this is going to be the beginning of really a revolution in dentistry, in looking at it from a completely different perspective. Our objective is that dentistry will be seen as the most highly respected specialty of medicine. In a world that's captivated and controlled by insurance, where our dear colleagues in medicine are often spending 10 to 15 minutes every 2 years with their patients, we have a tremendous opportunity. And I would say hygienists are really on the front lines and will be probably the primary providers of many of these things that we're talking about. And so we're just thrilled about that. I really want to invite anyone who's interested to check it out. Go to IDM Scholar Society on the internet, and then you can list for them that foundations course, how they can check that out too.
That is great. This is really an opportunity to take what we do to a whole other level. And it does take a team. So hygienists, yes, we're in the forefront. We see our patients so often and have this relationship with them, but it really takes the whole team to be on the same page, to have that culture within the practice. So at StellaLife, our mission is to improve people's lives. And I know that that is your mission, Dr. Wilkerson, as well as I think everybody on this call. So I am so grateful to you, and really want to acknowledge this wonderful event, which is a great, again, foundation, a starting point for those of us who want to really go along and move forward in this world of integrated dental medicine. So Dr. Wilkerson, thank you so much. We really appreciate your time again and your knowledge. So for everybody else, there will be information and links to be able to take advantage of the StellaLife Scholarship for this event. And any questions about that, you can always reach out to us. But thank you so much again, Dr. Wilkerson, and all of you on the call. We want to thank you for joining us again. And please come back next time for our next Innovator series. And until then, please stay healthy, stay safe, and above all, stay happy. Thank you all.
Thanks, Liz.